Hello, this is Dr. Hizon, here to talk about the documentation for a patient with type 2 diabetes. As a disclaimer, please refer to your particular doctor. This is a general course, not intended to be medical treatment. Your particular situation may vary. So the type 2 diabetic has multiple typical symptoms. They usually are overweight, they usually have very little physical activity, they have a family history sometimes of diabetes. They could have increased thirst, increased urination, and increased hunger. And you might hear this talked about as polyuria, polyphagia, polydipsia. Unintended weight loss, they can have, but they could have excessive weight gain. Blurred vision, slow healing sores, frequent infractions, and darkened skin, especially in the armpits and the neck. On the physical exam, we will usually talk about the vital signs, look at their fundoscopic exam, which is their eye exam, cardiac assessment, neurologic assessment, skin assessment, and extremity assessment, especially the foot examination. There'll be history and physical examination, lab work, and referrals if needed. The treatment starts with patient education, pharmacotherapy such as medications, and referrals if needed. There'll be lifestyle modifications, behavioral therapies, different kinds of medications, especially there are many type 2 diabetic medications out there. Monitoring is at least every 3 months and referrals as needed. So on lifestyle and home remedies, we especially will focus on nutritional programs. Type 2 diabetes is a nutritional disease. It should be treated with nutrition. You need to maintain a healthy weight and get regular exercise. The medication and therapies are as recommended, and you follow with your primary care physician or specialist as prescribed. So on documenting for the type 2 diabetic, a typical chief complaint would be a 32-year-old male presents for follow-up of diabetes that was diagnosed how many years ago. And you want to look at their past medical history, history of present illness, medications, durations, and you could put that into the chief complaint very briefly. More specifically on the history of the present illness, 32-year-old male with a history of associated symptoms, and just say male that has say diabetes but also hypertension or cholesterol problems, complains of associated symptoms for how long, and maybe here for evaluation, how long they had their type 2 diabetes, was it sudden or gradual, talk about their past medical, family, social history, what sort of symptoms do they have, any of these things such as polyuria or polyphagia, do they have any pain? If so, put that on a pain scale. Do they have intermittent or constant symptoms? How's the quality and what makes it worse? And also what makes it better? And do they have other symptoms such as bowel or bladder problems, respiratory problems? Do they have previous chronic medical history? As I mentioned, it's very common for them to have metabolic syndrome. And then also, what have they done so far for it? Have they had diets or been on supplements? Have they had surgery, exercise, weight loss programs? And what's their previous workup? Have they had physical exams, labs, specialty consultation? And then have they seen specialists such as endocrinologists or ophthalmologists? And then do they use tobacco? How's their exercise program? Obviously, we talked about the nutrition program is important to document, as well as their sleep. Have they lost or gained weight since the last visit? That's very critical, as well as to go through the rest of their review of systems. And then in the objective, generally we'll give an indication of what kind of distress they're in. HENT will look especially at their fundoscopic exam, and especially focus on cardiac exam, respiratory, abdominal, musculoskeletal, especially looking for their feet. You want typically going to have their shoes off and look at their skin, as well as for ulcers and the monofilament test, which is a test for neurologic evaluation. And on the assessment and the plan, in the assessment we'll look at medical decision making. Is this a simple case or complicated case? Does it require straightforward or complex decision making? And this is a time where your provider or physician will give reasons and rationales for the treatment they have decided on. The typical code, if you're screening for diabetes, it's Z13.1. If they have type 2 diabetes, it's usually E13.9 if they don't have any complications. But if they do have complications, it would be a different code like E11.8. So plan and treatment usually starts with patient education. They will encourage the patient to have lifestyle modifications. Most of the time they'll use some medication, follow up with their primary care physician and or specialist. Usually they need to see an ophthalmologist or optometrist at least once a year for retinal exams of their eyes. So be sure that you get the corrected affected side if they have an ulceration of their feet. Be sure to document all previous treatments and disorders and abnormal tests. Do they have a family history? Learn the various questions to ask, such as from their family history, social history, history of present illness, and past medical history. Please do not hesitate to ask your physician if you have questions about the documentation for the evaluation of the patient with type 2 diabetes. And also in primary care, do not forget to ask about quality measures, such as to document when their last colonoscopy was or mammogram. And takeaway points is that in type 2 diabetes, the body is not using insulin in the way it should. It is hyperinsulinemic. They have too much insulin and they're resistant to insulin. Over time, the high blood sugar can lead to serious problems with their heart, eyes, kidneys, nerves, gums, and teeth from both the high glucose and the high insulin. A person has a higher risk of type 2 diabetes if they are older, have obesity or being above their ideal weight, have a family history of diabetes, and are not exercising, and if they are on a lot of starchy carbohydrates. It is important to rule out any underlying conditions such as endocrine disorders, and it's good to learn the various questions to ask, and you as an informatics specialist need to read up more on the recommended nutrition and exercise regimens that are recommended for type 2 diabetics. And again, we appreciate all that you do, because while doctors save lives, medical informatics specialist scribes save doctors. Thank you.